India's population growth is steadily declining and is inching towards an average of 2 children per couple. This will help stabilize the country's population growth. Fortunately, India already has good policies in place for family planning, but the country will gain greatly with full implementation of these policies. Many couples, especially in rural India and urban slums, are like Lata and Ram here. They got married early, had their first child within a year, and soon after, a second child was also on the way. But unfortunately, this second pregnancy has complications. Lata's body is fragile as her second pregnancy is too soon and she is too young. Ram is very worried about his wife. Will she survive this second pregnancy? Millions of couples like Lata and Ram do not wish to rush into consecutive pregnancies or want to limit the size of their families but fail to use contraception. This unmet need for family planning stands at 13% in India. However, these seemingly low percentages translate to 30 million women who do not want to get pregnant but are not using contraceptive methods. Population Foundation of India undertook a study on cost of inaction in family planning in India to understand the opportunity cost of investing in family planning and the implications of not adequately prioritizing access to family planning services. The study projects a policy scenario where family planning programs are implemented to their full extent and estimates the potential costs and benefits to the nation over the course of 15 years from 2016 to 2031 by comparing it with the current scenario. The states of UP, Bihar, Rajasthan and Madhya Pradesh were focused as they contribute to half of all potential consequences related to lack of family planning services. As per the study's projections, inadequate investment in family planning may have the following consequences: 2.9 million additional infant deaths and 206 million unsafe abortions. In India, the desired fertility rate is less than 2. That is, women do not want more than 2 children. Unfortunately, there is a complete mismatch when it comes to contraceptive use, which is very low, of which female sterilization is the most used. Currently, India has a sizable young population with 65% under the age of 35, for whom spacing methods of contraception is the need of the hour. If Lata and Ram had used the contraception they required, the cost of inaction study reveals that their story would have been very different. The study projects that with well-planned families and fewer children, households in India can save at least 1/5 of their total expenses on childbirth and child hospitalization. Savings would be higher for households in Madhya Pradesh and Uttar Pradesh. The country as a whole will also reap the benefits of family planning. 1.2 million maternal lives will be saved. Government spending for programs on maternal health, child health and immunization will reduce substantially as a result of reduced childbirths. Cumulative savings on the National Health Mission budget are estimated to be around 270 billion rupees by the year 2030. And that's not all. Accelerated action in family planning can result in 13% increase in per capita GDP. So, what do we need to do to push the needle on this crucial issue? We need to address reproductive and sexual health needs of adolescents and youth. We need to increase allocations for spacing methods under family planning. We need every department or sector to join hands and make family planning a movement led by communities. We need to provide easy access to quality family planning services under Ayushman Bharat for universal coverage. When we do all of this, we will have a stable population growth where every child is wanted and healthy, leading to healthier, more fulfilling and more prosperous life for all families. Consequently, Lata, Ram and millions of other parents and their children will thrive. And so will India.